Welcome back, everybody. Dr. J here with Cameron, my good buddy, and we are going to bring you another episode of Flip the Script. We thought this time we would break down the skinny of my second book, Pain-Free Living, to upper body and lower body pain, and give a few pearls on how you can go about hopefully preventing, and certainly once, if you do acquire it, like 8 out of 10 people will do in their lifetime, will develop some form of debilitating neck and low back pain. So this is what I found over my years, a very common daily episode in my clinic, right? So I thought today we'd break down upper body, which includes neck, headaches, shoulder problems. And I want to, as usual, try to bring this into a really common sense approach. So I want us to think of the body as two triangles. And look at these triangles almost like you would a scale. So I want to keep the scale in balance. And the key to that is what we're going to talk about today. That's the key, in my professional opinion, over the years, to preventing a lot of these problems in the first place. So let me take a minute. I'm just going to kind of draw you those two triangles that I'm talking about into everybody out there. And Chris, would you make sure that my audible is good? Okay. So let's go with the upper triangle first. And that encompasses basically the shoulders across, up this triangle, into the head. So I want to think of it this way. And here's the spine down here. And then we get into the lower triangle, which is the tailbone and the hips, down into the legs. So this is my scale on the bottom side that I want to keep as balanced as possible. Everything above this is going to be affected when this scale gets out of balance. My upper scale, I want to think of it this way. Here's the arms hanging down off the scale. The weight being in the hands, okay? So I want to keep this triangle balance, which basically encompasses the shoulder blade, the scapula, okay? The muscles of the scapula come up and attach into the neck, which will then have a direct effect on anything up into the head. So we're going to talk about this triangle today and try to make it a simple, fun experience. So, again, let's talk about causation, right? Because what I found over the years, there's this one thing that we all do every day. It's sort of like I'd say, it's that one thing that you have to do to stay in optimal health, which is what? Sleep. So if we're compromising our triangles during that 6 to 8 hours of sleep, can you see where we start the day in a jacked position already? And then this can lead to so many of our daily complications that are associated with the upper back and the shoulders. And so we're going to present that to the public today and see how all these are connected to that upper triangle. All right. So first and most important, sleeping posture. Basically, there's two ways that most of us are going to sleep. There is the stomach sleeper. I'm sorry, the stomach sleeper, I used to say when I was first in practice, I wanted to get everybody off their stomach, right? And I still do. But you're talking about job security, somebody that sleeps on their stomach is always going to wind up with musculoskeletal problems. You have to, because you're going to suffocate if you don't turn your head one side or the other, right? So, but the majority of the population are back and side sleepers. So there's basically two different pillows that you have to have depending on which way you're sleeping. So this, and bless him, I know, a nice guy, but this pillow you see on television, that one perfect pillow for everybody, in my professional opinion, that That's not so. There is a different pillow when you're on your side than there is when you're on your back. Because let's take a minute. I want to just show people. Let's measure your shoulders and let me show you what I'm talking about. Camera, stand up for me if you would. So let's do a side sleeping posture, right? So if I'm looking at your neck to your shoulder, we've got 7.5 inches. All right, that's right in there, pal. So if your pillow is not this thick continuously when you're sleeping on the side, does it make sense to you? You've got to roll your shoulder to get the head to the pillow, right? So if I'm rolling my shoulder, again, we're talking about the triangle here. So we're talking about this area and this muscle here that comes up and attaches there. Now that's known as the traps and the levator scapula, the scapula being the shoulder blade. So if I'm rolling this to get my head to the pillow, I've got to have a contraction of this muscle continuously, right? So I'm going to jump out of the frame here for just a minute and show you what I'm talking about. You don't go anywhere. So Cameron, if I've got a patient sleeping on his side, I literally want a pillow that's this thick, all right, 6 to 7 inches, because I want to support the head and the neck without him having to. Most people think this is what we're going to do if the pillow's not thick enough, that we're going to lean the head to one side. We don't do that. Watch yourself when you on your side with the pillow too small. You're going to see that you are compromising the length of the shoulder to get the head to the pillow. Now this causes all kinds of injury conditions. One of the greatest is shoulder and rotator cuff problems. That's how important it is. I want to sleep as close as I can to perfectly straight on the spine. So I'm looking at a pillow for Cameron that needs to be about 7 inches thick, preferably foam, so that it doesn't compromise and break down, which a lot of the memory foam pillows might start off at 7 inches, but by the time you've been laying on them for a while, they're down to 5 inches, right? Okay, so that's the side sleeper. Now, let's talk about all those complications before we go to back sleeping associated with side sleepers. And what I found over the years, that when I'm taking a new patient's history, or even if a patient comes into me that I haven't seen in a while with a complaint, I can pretty much tell them what side they're sleeping on because of the complaint that they're presenting with. This side sleeper that sleeps on the right side, for example, will come in with complaints of pain in the front of the shoulder, pain at the back of the shoulder blade, like we were talking about, pain into the back of the head, because these muscles originate and then they insert. So that continual pull can create anything from headaches, TMJ problems. There's a nerve called the trigeminal, 3 branches through here. Anything that's innervating can present with a problem or a symptom. We can go up here and treat the nerve irritation that's occurring in the upper portion of the neck, but if we don't clear out that issue that's occurring where it's originating from the shoulder blade, then I'm only given temporary relief. So what I wanted to do and present with these books is just a common sense approach to how you can prevent an injury in the first place, and certainly prevent an exacerbation once it occurs. Now, and this book is a small book because it's really pretty much straightforward common sense. So if I got a patient side sleeping, they come in and they're complaining of numbness and tingling in the arm, well, what's happening when they're side sleeping? If the pillow's not thick enough, then again, we're having to roll the shoulder to get the head to the pillow. Now I've got nerves and blood supply running through this gap right here. So this is where a lot of people will complain of the numbness and tingling into the hand, all right, due to the compromise of the not only the nerve flow, but also the vascular flow. Okay, so the thing that we have to do, straighten that out. Same thing with a person who's sleeping on, let's say you're sleeping on the left side, they have the support here, they will still tend, if they don't have the support here, they will still tend to roll that shoulder to get the head to the pillow. And this shoulder will also do the same, right? So I've even woken up in the night with this upper side shoulder arm tingling, and I find that if I just bring it back along my body, that sensation will go away almost immediately. So this made me think, what can I do to support this upper shoulder as well, which I don't have to tend to do as much if I'm supported here, right? But I found I use a down pillow when I'm on my back because I like the flatness of the down pillow, and the feathers support the curve on my neck. We'll show that in just a second. But I'll take that down pillow, just the corner of it, and I'll place it right here under my armpit, and that will keep me from rolling inward with the upper arm. But I've also found when I was sleeping away from home in a hotel or something, I could take just a small little wash rag and shimmy it right up in here. It'll do the same thing, because that keeps us from subconsciously rolling both shoulders. And like I say, show me a 60 or 70-year-old side sleeper, and you're going to see this posture in them naturally, right? And all these symptoms compromising, including the shoulder. So, and I could write this in my second book, Pain-Free Living. One of my orthopedic buddies asked me, we were talking one time, and he wanted to know which person and athlete that I tended to see the most rotator cuff problems in. And I told him, amazingly, it's not the athlete. It's the 40 to 60-year-old side sleeper that I find most of those supraspinatus, impingement, rotator cuff type injuries, not the athlete. And if you honestly, most surgeons will tell you they don't make their living off of the athlete with their shoulder injuries. They make it off the layperson because of, in my opinion, this is the single greatest exacerbation to the injury, right? So,
Doc, this is a layperson's question.
Yes.
But what you think about how long you sleep?
6 to 8 hours if you're lucky. Right, Chris. So this is what I'm saying. You're in a compromised position. And a good point to that is when you're sleeping in that position and you're rolling that shoulder in, we're creating a situation. This is the model, if you will, of the right shoulder. So this is here, front side clavicle. And then, of course, the rotator cuff muscles in the back and one very large one in the front. So when I am side sleeping 6 or 8 hours, and I'm in this position, rolling forward, you see what I'm doing here is I'm doing what's called eccentric contraction into the muscles of the shoulder blade and everything that attaches, including everything that's inside the shoulder blade, right? And this large pec muscle is contracting down and in as well. Remember, my arm's rolling in. Well, people, eccentric contraction means to take a muscle and hold it in a position like this. Concentric contraction is when I'm pumping the muscle this way. Then the actin myosin fibers are backing back and forth, and it's pumping that lactic acid out of the tissue. So if I'm holding something in eccentric contraction like this, I'm having all this lactic acid building up in this area. And of course, we're shortening the muscle, so we're tightening it down. This is where the patient might wind up sleeping 6 or 8 hours like this. In the middle of the night or first thing in the morning, they get up and they move very quickly in the opposite direction. They will strain that muscle. This is where I have the patient comes in, and in very severe cases, they develop what's called torticollis. That is when the neck is literally stuck like this, and sometimes the shoulder will be pulled up this way. Your brother, I believe, Braxton, he came to me.
He woke up in severe pain. Yeah,
that's right. So, and this is what I'll see, and this is from sleeping for an extended period of time in this contracted position, and then the sudden movement gives them the strain. Very, very uncomfortable, and again, I can prevent that if I get my sleeping posture corrected, because here again, it's like I said, if you've ever been snow skiing, when you're going down that mountain, those quads are in an eccentric contraction while you're skiing. Now, so you ski on the first day, you get up and you ski the second day. You work that lactic acid back out. Eventually, you're going home. Eventually, you get home, and 24, 48 hours later, what I call the delayed onset muscle spasm, or DOMS as we call it. You wake up and think, who hit me with a baseball bat in my quads? You've experienced that before. This is that delayed onset, and this is what people are experiencing from sleeping on their side when they get up the next day and go, what happened here? So for a lot of my patients, they'll say, Doc, I didn't do anything. I understand. But yes, you did. You slept in a compromised position for most of your sleeping hours. So they'll get up and they'll say, hey, I just lifted something when I got up this morning, put this in the truck, and I threw my shoulder and my back out. In reality, no, you threw it out sleeping, and then you exacerbated it by that particular movement. Got it? So prevention, key, get your sleeping posture corrected as early in life as possible, because I'm here to tell you, and anybody over the age of 30, those habits are hard and difficult to change. The older we go down,
Yeah,
that stream of life, right?
it's hard to change how you're sleeping. So, and I was already talking to you about this, but like, if someone is doing all that and they're right here, okay, from sleeping and stuff, and then on top of that, they're also sitting at a desk hunched over or on their phone or playing Xbox, because I've noticed it a lot more with some guys that I know. Like one, he's 19 and he's dealing with real bad back tightness, knots in the mid back because of right here.
Yeah.
Okay, and then we went and we cupped up his upper chest and his front delts, front of the shoulder right here, where they all tie in, and it was so tight that he was in pain just from deadlifting. He wasn't even hitting those muscles, but it was just they were so tight that anything that remotely pulled on it,
Right,
'cause
shoulder
it was
blade, anything.
sleeping weird, all that, and so on top of sleep, sitting hunched over in bad posture could make that worse.
Well, good point there, dude. Because what we're finding now is what we call that cell, the cell phone neck. So, and I find it in adults too. They'll be in my waiting room, and I'll come out of a treatment room with a patient, and I'll see them there sitting there in the flex position. So, with that, if you think about it, what we're doing is, let me grab the spine and I'll show you. So what we're doing, now this is the back of the head, okay? So in the perfect world, we have a curve in our neck that looks like this. And I talk about this also in the book. Most people's neck over time will become compromised from a normal curve with a C-shaped curve, back of the head here, right? To where they will develop what we call a military neck that is straight. All right, now think about that, because we had these muscles that I was talking about that are going from the shoulder blade up to the back of the head, right? These muscles here. So if I lose that curve due to, most common is a whiplash, but it doesn't have to be an automobile accident, remember? How about somebody shoving you in the lunch line in 5th grade, right? Or, like I mentioned, we don't think about it, but what about throwing that little baby up who's enjoying that little ride up, down, and then you're catching them? That is a whiplash to that little baby. Now, the baby's having fun with that when you're throwing them up that particular day, but maybe tomorrow that baby's irritable, and of course, the infant really can't tell you what's going on, right? The baby got himself a little whiplash. So when we talk about what can cause the loss of this curve, it doesn't have to be the rear end automobile accident. If you're playing sports, football and other contact sports, this is happening all the time. So this predisposes him to that particular problem like you were talking about. So this is what we call flexion. This is forward. Remember, this is the back of the head. This is flexion. This is extension. Well, Cameron, people, when do we ever go into extension all day long? We really never go into extension. We're always flexing. So like you were talking about with the phone, we're always in this position. And what will happen is your proprioception is in the center of the brain, located in the ear area. So when we develop this posture where the ear is forward, what we call forward head syndrome, the shoulders want to be under the ear. So that's going to create a posture that is always this way. And then your mom can say, Cameron, hold your shoulders back. Well, as long as you're consciously thinking about it, you may do that. But when subconscious takes over, proprioception of that brain, those shoulders want to come back here again. So all day long. And then, like you said with your friend, now we go in and we perform an exercise like pulling a deadlift, which is actually, again, everything's in front of us, right? Attached to that triangle that we're talking about today.
Well, I even noticed another thing is I was doing crunches or some core exercise in the gym, and my abs started to cramp up, and it was because I was sitting here a lot, just like this. Mm-hmm. So I got on this one machine, it's GHD machine, where you put your feet in and go back, and it really like stretches out the core, and it was just so tight, but that fixed it. And so now
so
my
another
posture,
part, like we were talking about with that eccentric contraction, the abs are in that tight eccentric contraction.
The same thing with my neck. Like I never, like right here,
Yes.
stretch it out. Like you never really do that. And
So, let's talk about that for just a second. Remember, again, we got the shoulder blade. This is the right shoulder blade. It's attached over here. And I have muscles that are attaching from here that are going up directly into the neck. The levator scap to elevate the scap, the traps, they're here. So I want you to think about back when you were a baby and you learned to crawl, that's when you developed this curve in the neck, what's known as the cervical curve, right? Okay, cervical lordosis. Now, I had these muscles that run from the shoulder blades and attach up here. They attach through the cervical vertebra and up into the top of the cervical vertebra. So can you just imagine if something in life, let's say, I don't care, it's, again, you're playing football or somebody fall off a bicycle, whatever, and we create this whiplash. When that happens, you can lose that curve for a lifetime. So if I have these muscles that are attaching here and my curve looks like this, what happens with that whiplash when that curve now goes to here? These muscles, do they rip out of the back of your head? No. So now this continual contraction all the time with tension, stress, cold weather, postural stresses, that causes these muscles, they're going to contract towards what's known as the belly, the thicker part of the muscle. That pulls here, compromises nerves and blood flow. And here's our symptoms such as headache and anything that those nerves happen to innervate, like the sinuses. This is where the connection between these upper vertebrae and things like sinus issues are connected physiologically, right? So I want to remove that interference. Now, the sad truth is because these treatments are very, very, very low force, once that curve is lost, we're never really going to reverse that curve just simply with the adjustment. So it requires more of a sustained postural stress put on something like a fulcrum through here. And again, it takes a very long time of consistent treatment in that position to change that curve once it's lost. So most people, by the time they lose that curve, even though we can relieve a lot of these issues and symptoms, the postural stress is still always going to be with them, right? And since we're upright working against gravity all the time, again, why we see 8 out of 10 people will eventually wind up with a debilitating type injury in this upper triangle area. That's how common. And I can tell you 8 out of 10 people listening right now have been here. So with that in mind, that's why the back sleeper wants a flatter pillow. All right, let me give you an example of what I prefer. All right. So with my back sleeper, I want the flatter pillow. Now I like the down pillow because literally the feather, when I lay my head on it, I want my head against the shoulder, the base of the pillow here. My head will actually create a little indentation that will support when I'm on my back. It will allow this curve, this position. So if I'm on my back, and this is the back of my head, and I'm on that thick side sleeper that I was telling you about, what's that going to do to this neck? Well, it's going to put it in flexion while I sleep. So I'm still compromised while I sleep. Again, straining the neck. So therefore, on my back, I want flat, or preferably if I can get something that will support the curve and let the head drop back like a down pillow. That's why I prefer that. That's what I like about that. When I roll onto my side, I have my thick pillow against my headboard. I just simply roll to the side, flip it down, boom, take my down pillow out from underneath my neck, drop it right here, put the corner of it here, and it keeps me from rolling this way. So now I'm sleeping in this position, uncompromised like this. When I wake up in the morning, I can feel the difference. When you're side sleeping like that, you may wake up 2 or 3 hours later and already feel the injury that's occurred, or certainly the tightness, right? So that's why, as early as you can, make these changes.
Doc, I'm taking a lot in right now, brother, because I certainly don't think near about how I sleep and what I'm doing while I sleep, and I don't think the average Joe does either. You
And
know,
of course not. You know, I mean, it's something that by the time, and we don't. And again, Chris, it's something, that one thing that we do for a greater period of time than anything else. Now, some people unfortunately may have to, in their job, drive, say somebody who does sales and has to drive 6 or 8 hours a day. Okay, well, that's another person that will compromise other issues, and we'll certainly talk about that when we talk about the lower triangle later. But you're right. Again, most people aren't thinking about this until they severely bring in symptoms. Now, the other thing is, in my opinion, it's one thing for the doctor to be able to relieve these symptoms. But what I want to do is educate my patients on the prevention of it in the first place, because this is really, I hope, common sense. However, it's not something that we tend to be taught by those people who are treating us with these issues. So again, I find that for a lot of my patients, I certainly decrease the frequency that I have to see them. And with that, the expense associated with it. Now, I know a lot of my compadres out there in the profession, musculoskeletal doctors who treat, whether it's the chiropractor, the osteopath, the physical therapist, the physiotherapist. I'm letting the cat out of the bag sort of here, all right? And it's just hopefully I'm simplifying it, because the key is, one, getting your patients out of the pain, but two, educating them and empowering them so they're not continuously having the same issue over and over, or manifesting itself into a rotator cuff type injury that might wind up in a surgical type of intervention problem. So that being said, so I'll give you an example. I had a patient that came in just yesterday, and I hadn't seen this young man in over a year. So when I first saw him a year and a half or so ago, it was for his low back. So this time he comes in with a neck and shoulder issue. And again, I promise you, this was associated with what we were just talking about. And so I asked him, I said, well, by the way, he said, how's the low back doing? And he said to me, he said, well, Doc, since I got the book and you explained to me about using the pillow between my knees when I sleep, my low back has not bothered me again. That's what I love to hear. Teach them as early as I can, but it doesn't make a difference. I also write this in my book. It doesn't make a difference if you're 2 or 80 years old. I've seen this be the game changer for people, relieving these pains and also preventing that exacerbation in the future. So.
Yeah, obviously we're not getting into the lower body stuff, but the leg between the pillow between the legs, that's the one thing that's I can feel a huge difference just in my hips.
Yeah.
From sleeping and whatnot. But yeah, I've definitely experienced that, sleeping on the side, waking up, and it's super weird. It's like everything feels right here. And you were like, get inside a door frame and go up in here and stretch out that chest. And that helped me a lot, but that was a long time ago.
Well, Cameron, let's do that. We were talking about this the other just the other day. So stand up, if you will, on the camera, and I want you to over-accentuate that forward curve of the shoulders, right? So let's see, for example, and then from here, when you over-accentuate that curve that we're talking about that a lot of people walk around like, now try to just bring your arms up from the side. And you see how compromised you get about right there. There's a lot of discomfort. Now bring your shoulders back, and you can bring them all the way up, right? Yeah. So you see how some people don't realize that this loss of range of motion that's developed in the shoulders is from that rotation, that forward rotation. Mm-hmm. It also causes the humerus to roll inside. And the larger you are, and the more muscles that you hold in the chest area, because you think about this, the chest area is, the whole posterior backside of the shoulder, all 4 of those muscles are about the size of the pec in the chest. Mm-hmm. So if you're compromising that and you're flexing this chest and compressing it down over time, the more likely you are to develop these symptoms and these problems. So the larger person is going to get into problems with this to a greater extent than the 100-pound female for the most part. But she's still not excluded from this because give it enough time, I see the same thing with them, right?
You told me that once. You said that guys in the gym suffer from it a lot. You always see them walking around like this because, and it's not because they have this huge back. It's because they actually don't train their back, and it's that they train what they can see in the mirror, and so they're just training their, you know, their arms, shoulders, everything here. They're training it, and so that just gets tight. They're sleeping that way. So all these guys in the gym walk around like this, looking stupid, you know. And
So I
then
had a competitive bodybuilder, and a national competitive bodybuilder. He came up to me one day in the gym, and he was having that problem because when he was trying to squat, he couldn't get his right arm behind the bar because it was so compromised in the what we call the forward and internal rotation position, and it was creating a lot of numbness and tingling. Now I'm gonna tell you, if that's in the left side, which is usually involved with some kind of heart condition, then people really start to panic, right? So I explained to him that he needed to perform more stretches to the pec, all right? Slow stretches to the chest area. And I explained to him the pillow and sleeping properly with a large enough pillow, because when I asked him what kind of pillow he was using, far too small. Saw him in the gym probably 3 weeks later. And I went up to Matt and said, Matt, you know, how's the shoulder working out? He says, man, you fixed me. And I didn't touch him. All I did was give him this information. And he took it and resolve that particular problem just through the knowledge of how to keep from exacerbating it, especially as large as he was, right? And of course, that way he was able to keep on doing that thing by which he loves. So when these kind of things are affecting your lifestyle, your exercising, correct them before they become an injury, because they will. They'll compromise with that forward posture into shoulder injuries and rotator cuff injuries. It's for a lot of people, it's only a matter of time. So, again, this right here is a lot to take in. Hopefully, I've kind of made it common sense for people, because it is a game changer. And with the amount of info we put in there, why don't we go to the lower triangle on another day? Because again, that's 8 out of 10 people as well. Sound good?
Absolutely.
So that's it for this one. Hope you guys enjoyed that little bit of info, and that it will help you on a daily basis. So for Cameron and myself, until next time, have yourself a great day so you're not missing one.